The standard American diet, of course, today is sadly undernourished as far as servings of vegetables, servings of fruit. We know that we're getting probably 1/3 the amount of produce we need if you count fruit and vegetable combined. Even if you think you're buying the right food, you're not getting the right nutrients. Now, oranges can lose their vitamin C just rolling it across the floor 5 feet and hit the wall very gently. What about oranges shipped from Ecuador? I mean, how much vitamin C is going to be left in that by the time it gets to your tabletop, to your kitchen? One of your major, won't say the name, fast food milkshakes, strawberry milkshakes, has 47 synthetic ingredients in it. Major food groups now are just delivering very little nutrition, but possibly even some dangerous ingredients. Basically, they're not food, is what they are. They're not recognized by the body as nutrients that can be absorbed into their cells and used to run the body's machine. There's another evolving science called drug-induced nutrient depletion. Now, those are drugs that deplete critical nutrients. If not identified and replaced, can cause further health erosion, or maybe more prescriptions. So basically, I think the smart alternative is to take the right supplement program built just for you. Well, after years of working with patients with both pharmaceuticals and nutraceuticals, and understanding that everybody has their own unique health problems, their own unique lifestyle, their own unique dietary habits, that any true nutritional program should be designed around a personalized factor, which would be one size does not fit all. In fact, it fits nobody. When we built IDNutrition, we had no products. So we started with the science, the facts. We reviewed the medical literature. We looked at over 7,000 algorithms to develop the science behind the reasoning of why a product would be recommended. Why is it safe? Why is it effective? The assessment then was around those questions that would reveal the differences between people in diet, dietary habits, lifestyle habits, medical conditions, and prescriptions. And once we identified what the assessment would be, only then did we build the products. Our whole commitment here is the integrity of the information. The product is just a reflection of that integrity. The assessment is a 25 to 28 question online questionnaire that looks into a consumer's allergies, their dietary habits, their lifestyle habits, their medical conditions, and then they're looking at their prescriptions as well as what their goals are as far as taking nutraceuticals or a supplement program. All the information then would be run through a database that makes various recommendations based on the answers given. So at their fingertips, that consumer is given all the information that we glean from 5,200 journals per month that put in the database to give them the absolutely up-to-date, most personalized assessment that they can get. If they've changed drugs, if they change their diet, they go in and they change their answer and their recommendations change. So IDNutrition changes as the person changes. And then on the other side, we're changing things scientifically every day, looking at these new studies every week. We don't use anything artificial. There's hardly a vitamin that you would buy in a big vitamin retailer or in a drugstore or in a grocery store that is not loaded with synthetic vitamins. Your body doesn't recognize them. And that's where IDLife is putting together, is formulating these programs in answer to your recommendations based on scientific research, the best product for you, and the quality of these ingredients are all researched. They're manufactured at FDA, CGMP approved facilities, Class A facilities, very high tech. And the formulas that are put together are using pharmaceutical grade nutrients. It's about the science, it's about the ingredients, it's about the ingredient levels, it's about what time of day we give it, It's about everything we do. I mean, there's many dozens of little steps that we perform that make our product the finest. Preventative health is what the future is here. Not to wait until you need that first prescription. It's really about being proactive and preventative, and that's what IDNutrition's about. We have a scientifically, medically based program here that complements your medical therapy, your physical therapy, your pharmaceutical therapy, with now your nutraceutical therapy. You value your health, and knowing today what you do at 30, 40, 50 years of age will impact tremendously the quality of health you'll have when you're 60, 70, or 80. I can't imagine why anybody wouldn't try this.